Hello, this video is about brain areas for language. My name is John Edwardas Nacu. I am currently a first year student studying EB Psychology at Bataan Peninsula State University. For this video, I will be tackling two brain areas, starting with Broca's area and Wernicke's area. And I will also be discussing about the language dysfunction that is aphasia. Moving on. Broca's area is named after Paul Broca, a French physician and anthropologist who discovered and examined this brain area in the 19th century. Broca conducted research in the 1860s. So, the primary function of Broca's area is related to language creation and communication. It is required for motor planning and muscular coordination to perform the physical act of speaking. So, when we're talking about Broca's area, we are referring to uh, language production, being able to uh, choose your words wisely, being able to properly articulate your sentences, and properly have a good grammar. Broca's area is required to comprehend the complexities of language processing in the brain. Broca's area contributes to a better understanding of how the brain orchestrates the complicated processes of speech production, as well as the diagnosis treatment of language disorders with this area. Moving on, we have Wernicke's area. Wernicke's area is named after Karl Wernicke, a German neurologist who identified this brain region in the 19th century. Wernicke's area is critical for understanding language and speaking effectively. Damage to this area can result in Wernicke's aphasia, a kind of language disease characterized by fluent, nonsensical speech and impaired understanding. When we're talking about Wernicke's area, it refers to uh, language comprehension, being able to understand, to comprehend uh, things around you. So, understanding Wernicke's area is critical for unraveling the complexities of how the brain processes and comprehends language, as well as increasing our understanding of language disorders and assisting in diagnosis and therapy. Moving on, we have aphasia. Aphasia is a language disorder caused by impairment to the brain's language processing areas. So, there are different causes of aphasia. Uh, the most common is stroke, second is brain infections, head injuries, and dementia. Well, the signs and symptoms and intensity may vary depending on the person. There are four types of aphasia, and those are expressive, receptive, anomic, and global aphasia. So, when it comes to expressive aphasia, uh, ito yung ano, ito yung kapag naiintindihan mo, naiintindihan mo kung ano yung, ano, kung ano yung sinasabi mo, or sinasabi ng iba, pero hindi mo kayang i-express or sabihin, or i-communicate ng mabuti. So, we have receptive naman, which is finding it difficult to difficult to speak. Yan. And next is anomic. Anomic aphasia naman is kapag uh, kapag nahihirapan kang gamitin yung mga tamang words para mag-form ng sentences or para matama yung grammar mo. Yeah. And global aphasia. Global aphasia is the worst type of aphasia kasi it affects writing, speaking, writing, understanding, and communicating in general. So, in summary, Yung Broca's area tsaka yung Wernicke's area, parehas lang silang nasa left hemisphere. Yung ano lang nila, yung pinakaiba lang nila is Broca's area is nasa posterior part of the frontal lobe. Meanwhile, yung Wernicke's area naman is nasa posterior half of the superior temporal gyrus. And ayun, aphasia, a disorder when an individual is experiencing language processing difficulties like speaking, listening, reading, and writing. And we also have the last four types of aphasia: expressive, receptive, anomic, and global aphasia.